The recent revelation that the BBC is allocating a significant portion of its licence fee revenue, a whopping £650,000, towards private healthcare for its staff has sparked widespread outrage. This move has critics up in arms, with many calling for the abolition of the licence fee altogether. The BBC intends to award a contract of this magnitude to a private firm, enabling its employees and fixed-term workers to access remote GP appointments via online or phone consultations. The scheme, which is currently out for tender, is set to operate from February 2026 to January 2029, with a potential extension until 2031. However, this decision has not gone uncontested. Critics argue that it is utterly indefensible to expect the public to foot the bill for such a service when they themselves face prolonged waits for NHS appointments. They believe that the licence fee, which is already a contentious issue, should be done away with entirely. A source from the TV industry voiced their frustration, stating, "When the public can't even secure a GP appointment, our licence fee is being used to guarantee BBC staff immediate access. It's a farce." This controversy comes at a time when the NHS is facing unprecedented challenges. Last week, it was revealed that waits of over a month to see a GP have reached an all-time high. An analysis of NHS England data by the House of Commons Library revealed a staggering increase in the number of people waiting more than 28 days for an appointment, jumping from 4.5 million in 2021 to 12.9 million in the first half of this year. Furthermore, the NHS has warned patients that the waiting time for non-urgent, consultant-led treatments can stretch as long as 18 weeks from the day an appointment is booked. William Yarwood, media campaign manager at the Taxpayers Alliance, added to the chorus of criticism, stating, "It's outrageous that while millions struggle to access GP services, the BBC is utilising licence fee funds to establish a private healthcare system for its staff. This two-tier system, where viewers are compelled to pay for privileges they themselves cannot enjoy, is a stark demonstration of the BBC's disconnect from the realities faced by the general public. The licence fee must be abolished. It is indefensible to continue burdening households already struggling financially to support such an arrangement." In response, a BBC spokesperson defended the decision, stating, "As a 24/7 global media organisation, many of our teams operate on irregular schedules and in locations where NHS access is not feasible. We provide remote GP access as part of our duty of care, aiming to reduce sickness absence and ensure the continuity of our services for audiences." This controversy raises important questions about the role and responsibilities of public service broadcasters and the fair distribution of resources. What are your thoughts on this matter? Do you believe the BBC's decision is justified, or do you side with the critics calling for the licence fee to be scrapped?